Hello, my name is Cameron Sabat, and this is Cutting to the Case, Conversations in Orthopedics. And today I'm joined by Dr. Gary Pess. And Gary Pess, he is a minimally invasive hand surgeon who's trained at SUNY Downstate for medical school, NYU for orthopedics, and Massachusetts General Hospital for hand and upper extremity, specifically in microsurgery. And now he leads he's the medical director of a 7-person hand-only surgery center, as well as medical director of other surgery centers, a 100% surgery center legend. And so I welcome you to the podcast. Thank you very much for showing up.
Happy to be here.
Of course. So we can dive right in. You've built a career at the intersection of orthopedic surgery and minimally invasive technique. And this is unique in orthopedic surgery. What first drew you to this less invasive methods, and how have they transformed your approach to hand pathology?
I mean, the patient is our purpose, and recovery after procedures are key. And always lean to trying to do the smallest incisions and the procedures that would help the patient recover quickly. They can return to taking care of their children, return to work, return to sports. So I started with endoscopic carpal tunnel releases in 1990 when it first came out. I developed with one of my residents a knife that we use to do percutaneous trigger finger releases. And after finding multiple recurrences of Dupuytren's contracture after open surgery, I went to Paris and trained and learned how to do needle aponeurotomy.
Absolutely. And as minimally invasive surgery has gained popularity across the specialties, what are some misconceptions patients or even surgeons have still about hand and wrist care?
I mean, definitely, some people feel that you may not be seeing all the pathology when you're doing something minimally invasive, or you're not opening it up to see everything that you need to, and that's absolutely untrue. Once you're experienced at doing procedures minimally invasively, you know when you need to go further, and when you can't do it minimally invasively, and just do the procedure to help the patient heal quickly.
Absolutely. And speaking of healing quickly and really accessibility, you've practiced in both urban and suburban settings across New Jersey. How do you ensure that those cutting edge, minimally invasive techniques that you trained on at arguably the best institution in the world remain accessible to a broad range of patients?
I think it's critical that no matter what socioeconomic group somebody's from, they should have the opportunity to be treated the same way as anybody with unlimited funds. We offer this to all our patients, whether they have no insurance or they have the best insurance on earth. I treat all my patients the same and offer them the same type of treatments.
Mm-hmm. And patient satisfaction and those recovery timelines are really key metrics in modern surgery. And we saw that recently with CMS rolling out the THA-TKA proms that came out, the patient-reported outcome metrics, recently in July. And so what role does minimally invasive surgery play in improving these outcomes in practice?
In my personal practice and in our group, we found that the prom numbers are very solid. They're much higher. Patient satisfaction is higher, function is higher early on after a minimally invasive procedure. And when we get specific for Dupuytren contracture, offering needle aponeurotomy or collagenase to treat patients as opposed to opening up their whole hand and taking months to heal and requiring multiple therapy, gave a much higher patient satisfaction and
Absolutely.
Success.
Yeah, no, I appreciate that. And I want to be respectful of your time because we understand this to be a 5-minute interview here. So looking ahead, this is arguably the most important question for our audience listening. What advice would you give to early career orthopedic surgeons seeking to build a practice rooted in high-tech, low-trauma interventions for hand and upper extremity conditions?
I think it should be a goal to keep up with the most modern technology, be on the cutting edge, learn from the people that are utilizing the new technology as opposed to old treatments which are kind of passé. Every young surgeon coming out will discover that no matter what they know, probably within 20 years, you're only going to be doing 5% of what you did the same way. The technology advances rapidly, and you need to stay on the cutting edge to give your patients the best results.
Absolutely. And thank you very much, Dr. Pess, for joining this podcast.
My pleasure.
We really appreciate it. And this is Cameron from Cutting to the Case signing off.